Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
You hear a doctor talking to a patient.
Good morning, doctor.
Good morning. Tell me about your problem.
I am having severe and recurrent jaw pain, doctor. There's also numbness and tingling along the jaw, teeth, and tongue.
How long have you had these problems?
For the past 6 months, I even consulted a dentist, but the dental evaluations are normal. I was also diagnosed with a throat infection last week, and I was prescribed Avalox, which I've almost completed. I am taking cough drops and trying to increase fluids.
Oh, I see. Do you drink or smoke?
No, doctor, but I used to chew tobacco for about 30 years, but I've recently stopped.
Okay.
Moreover, I've also lost the sensation of taste. The numbness is on the left lateral tongue and jaw that extends from the angle of the jaw to my lip, doctor. Recently, I've gained about 20 pounds of weight, and that may be due to decreased activity.
Do you get headaches?
Yes, doctor, about twice in a month.
Do you experience any fever or chills?
No, doctor.
Do you have any tooth pain, especially while biting?
No, doctor.
Have you had any jaw popping?
No, doctor.
Any spasm of the jaw that is trismus?
No, doctor. I've stopped chewing tobacco, and I'm using Nicorette gum now, doctor.
Okay. What's your age now?
50 years.
Have you ever had any surgery?
Yes, pertinent for hernia repair surgery.
What medications are you taking at the moment?
Tylenol, and I'm on Nicorette gum.
Are you allergic to any medicine?
Yes, I'm allergic to codeine. I used to feel dizzy or lightheaded when I took codeine.
Your blood pressure is 138/82, pulse 64 normal, temperature 98.3, and your weight is 191 pounds. Your oral cavity is normal with good moisture. You have a slightly decreased sensation to your left jaw that extends to the left lateral tongue and left intrabuccal mucosa. The fiber optic nasopharyngoscopy reveals a moderately deviated nasal septum to the left, large inferior terminates. You have developed persistent paresthesia of the left manual teeth and tongue, possibly neoplasm within the mandible. You have also developed hypogeusia with loss of taste and dry mouth syndrome called xerostomia. I would suggest you have a CT of your head, including sinuses and mandible, so that I can evaluate and make sure you have not developed neoplasm. Take plenty of fluids and come and see me again when you get your diagnosis reports.
Extract 2. Questions 13 to 24. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
You hear a doctor talking to a patient.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina, palpitations, or syncope?
No, doctor, but I feel some irregularity in my pulse. Over the past 10 months, these symptoms have been gradually worsening. Over the past year, I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes, mellitus, or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history. Any illness?
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. Aspirin, 81 milligrams daily, and chlordiazepam and clidinium combination pill at 5 milligrams or 2.5 milligrams, 1 tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute, and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound and a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of body mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid stimulating hormone 1.33. Your glucose is 97 and creatine 0.9. Potassium is 4.3. I reviewed your echocardiogram thoroughly. That shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33%, and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin converting enzyme inhibitor lisinopril 2.5 milligrams daily and a beta blocker carvedilol 3.125 milligrams twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 milligram daily. I don't think you need a defibrillator right now, and after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.
That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25. You hear a physician explaining to his staff about azotemia. Now read the question.
Hello, doctor. Can you please explain azotemia to me?
Azotemia is a kind of nephrotoxicity that occurs when there's nitrogen in our blood. Uremia occurs when there's urine in your blood. When excess nitrogen becomes toxic to our system and results in uremia or uremic syndrome. If untreated, azotemia can lead to acute renal failure. When fluid isn't flowing enough through the kidneys, prerenal azotemia occurs, creating high levels of urea and serum creatine concentration. This is the most common type of azotemia and can be reversed. Usually, intrinsic azotemia is caused due to sepsis, infection, or disease. Acute tubular necrosis is the most common type of intrinsic azotemia. Postrenal azotemia is caused by an obstruction in the urinary tract. Postrenal azotemia can also occur with prerenal azotemia. Question 26. You hear a physician explaining to her nurse about bilirubin blood level. Now read the question.
Hello, doctor. What is a bilirubin blood level?
As a result of breakdown of red blood cells, bilirubin is released into the blood. Bilirubin is used by the liver to make bile. Generally, a small amount of bilirubin is present in the blood. The increased level of bilirubin in blood could be a symptom of a liver or blood problem. A common cause of increased bilirubin is Gilbert syndrome, a deficiency in an enzyme. As the bilirubin levels in the blood get higher, the white part of our eyes, called sclerae, may turn yellow. Also, our skin may appear yellowish. This is called icterus or jaundice. Question 27. You hear a physician explaining to her nurse about celiac disease. Now read the question.
Hello, doctor. Who really has celiac disease and who doesn't?
Well, according to findings, about 40% of people worldwide may have a genetic susceptibility to develop celiac disease, where they react to gluten in their diet. However, what I feel is about 1% develop celiac disease. Those people do very well on a gluten-free diet, avoid wheat, oats, and rye. However, gluten is very tough to digest, therefore it's very gassy. So I think people who buy gluten-free foods are really avoiding gassiness. But I think most people are not really bothered by gluten. A simple blood test can help identify those with celiac disease. But simply avoiding foods to get rid of celiac disease is well worth continuing.
Question 28. You hear a discussion about congenital myopathy and its types. Now read the question.
Hello, Doctor. What is congenital myopathy and what are its types?
Congenital myopathy means that a person is born with myopathy. Sometimes a hereditary medical illness does not develop symptoms until a person grows into an adult. Mitochondria myopathy is caused by a defect in the energy-producing part of the cell called the mitochondria. There are several types of mitochondrial myopathy which are caused by hereditary mutation abnormalities in the genes. However, they can also occur without any family history. Metabolic myopathy is a group of diseases caused by metabolic problems that interfere with the muscle function. Generally, this condition is caused by defects in the genes that code for certain enzymes that are essential for normal muscle movement. Nemaline myopathy is a group of disorders characterized by the presence of structures called nemaline rods in the muscles. Nemaline myopathy is often linked with respiratory muscle weakness. Central core myopathy is an inherited disease causing weakness, bone problems, and severe reactions to some medicines. Muscular dystrophy is a group of diseases caused by degeneration of the muscle or abnormally formed muscle cells. The main difference between myopathy and muscular dystrophy is that muscles do not function properly in myopathy, whereas the muscles degenerate in muscular dystrophy. Question 29. You hear a discussion about primary brain tumours. Now read the question.
Hello, Doctor. What are the types of primary brain tumours?
Well, there are many types of primary brain tumours which are named according to the type of cell or the part of the brain in which they start. For instance, most primary brain tumours begin in the glial cells. This type of tumour is called a glioma. Among adults, the most common types of brain tumours are astrocytoma tumour, arises from star-shaped glial cells called astrocytes. It can be any grade. In adults, an astrocytoma most often arises in the cerebrum. Oligodendroglioma tumour begins from cells that make the fatty substance that encases and protects nerves. It usually occurs in the cerebrum. Oligodendroglioma tumour can be either grade 2 or 3. Meninoma tumour begins in the meninges. It can be grade 1, 2 or 3. It's usually benign grade 1 and grows gradually. Question 30. You hear a discussion about different types of aspergillosis. Now read the question.
Doctor, what are the different types of aspergillosis?
Well, aspergillosis is a disease caused by aspergillus, a common mold or a type of fungus that lives indoors and outdoors. Commonly, people breathe in aspergillus spores daily without getting sick. However, people with weak immune systems or lung diseases are at higher risk of developing health problems due to aspergillus. There are different types of aspergillosis. Allergic bronchopulmonary aspergillosis causes inflammation in the lungs and allergy symptoms such as coughing and wheezing, but doesn't cause an infection. Allergic aspergillus sinusitis causes inflammation in the sinuses, and symptoms of a sinus infection are drainage, stuffiness, or headache. In the contagious aspergillosis, aspergillus enters the body through a break in the skin and causes infection, usually in patients with weak immune system. Aspergilloma, also called a fungus ball, it is a ball of aspergillus that grows in the lungs or sinuses, but usually does not spread to other parts of the body. Chronic pulmonary aspergillosis is a long-term condition that lasts for about 3 months, and which aspergillus can cause cavities in the lungs. One or more fungal balls may also be present in the lungs. Invasive aspergillosis is a serious infection that usually affects patients with weak immune systems, such as organ transplant or a stem cell transplant patient. Invasive aspergillosis most commonly affects the lungs, but it can also spread to other parts of the body.
This is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear the lecture given by a physician on different categories of strokes and their location. You have 90 seconds to read questions 31 to 36.
Doctor, please explain different categories of strokes and their location.
Well, there are many different types and categories of stroke. The two main types of strokes are defined by their location and by the cause of tissue damage in the brain. Cause of tissue damage. Often the causes can help determine the prognosis and appropriate method of treatment. Stroke caused by a blood clot is known as ischemic stroke, caused due to the lack of blood supply, oxygen and vital nutrients to a specific region of the brain tissue. An ischemic stroke may be caused by an embolus, a blood clot travelling from another part of the body. It may be caused by a thrombus as a result of a cerebrovascular disease. Or it may be caused due to vasospasm, the sudden severe narrowing of a blood vessel in the brain. Bleeding of a blood vessel in the brain results in a hemorrhagic stroke. At times, the rupture of a brain aneurysm causes bleeding. Extreme changes in blood pressure may trigger the rupture of a brain aneurysm. At times, a region of the brain that was damaged by ischemic can bleed within the first few days after a stroke, causing a secondary hemorrhage. A watershed stroke is caused by low blood pressure or low blood flow, compromising the blood supply to susceptible regions of the brain. A watershed stroke may occur in areas of the brain that are supplied by tiny arteries. Strokes are also characterized by their location, since the affected part of the brain links to specific neurological or behavioral deficits. A cortical stroke affects the cerebral cortex that controls high-level processing. Different parts of the cerebral cortex control different functions. Frontal cortex or frontal lobe stroke often causes muscle weakness on the opposite side of the body and trouble with decision making. Patients with a stroke involving the frontal cortex may display socially inappropriate behavior, paranoia, or may regress in maturity. Occasionally, this may result in loss of bladder or bowel control. The parietal cortex is involved with integration of language and sensation. Patients with a parietal stroke often display impaired sensation or trouble with speech. The occipital cortex involves vision. Therefore, a stroke in this area may cause partial or complete loss of vision on the opposite side of the occipital region affected. The temporal cortex is involved with language and hearing. Patients with a temporal lobe stroke often have trouble understanding the spoken or written language. A subcortical stroke affects the deeper regions of the brain. Usually, a thalamatic stroke causes significant sensory deficits on the opposite side of one or more parts of the body, even when the stroke affects a relatively small region of the brain. A stroke affecting the internal capsule may affect sensory or motor function of one or more parts of the opposite side of the body. A brainstem stroke causes a wide variety of symptoms and signs. It may cause weakness, sensory changes, or troubled speech. This condition can affect the movement of the opposite side or the same side of the face or mouth. Patients with a brainstem stroke may have trouble with eye movements, manifesting a double vision or blurred vision. In addition, the brainstem controls breathing and regulates the heart rate. A brainstem stroke may affect vital functions, even when a relatively small area is affected. Some strokes are named after the blood vessel that was bleeding or blocked. The most commonly identified blood vessel in a stroke is the middle cerebral artery that causes a large cortical stroke affecting the temporal and parietal lobes. Now look at Extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on the hemolytic anemia. You have 90 seconds to read questions 37 to 42. Hello everybody. I am going to explain to you different types of hemolytic anemia. Hemolysis is the breakdown of red blood cells that typically has a lifespan of 120 days. After this duration, they die and break down. One of the main functions of red blood cells is to carry oxygen to every part of our body. Therefore, in case the red blood cells break down abnormally, there will be very few of them to carry oxygen to our body parts. Certain diseases and conditions cause red blood cells to break down too early, resulting in fatigue and other more severe symptoms. There are different types of hemolytic anemia, and the conditions can be either inherited or acquired. Let me explain to you certain disorders and conditions of different types of hemolytic anemias. Inherited hemolytic anemias usually occur due to a faulty gene that controls red blood cell production. While moving through the bloodstream, abnormal red blood cells may be fragile and break down. Sickle cell anemia is a severe inherited disease where the body produces abnormal hemoglobin, causing the red blood cells to have a crescent or sickle shape. Sickle cells usually die within 10 to 20 days as the bone marrow can't produce new red blood cells fast enough to replace the dying red blood cells. In the US, sickle cell anemia mainly affects African Americans. Thalassemias are the inherited blood disorders where the body can't produce certain types of hemoglobin in adequate quantity, causing the body to produce less healthy red blood cells. Hereditary spherocytosis occurs when the outer covering of red blood cells, called the surface membrane, is defected. In this condition, red blood cells have an abnormally short lifespan and a ball-like or sphere shape. Hereditary elliptocytosis or oval cytosis causes a defective cell membrane in which red blood cells are abnormally oval in shape, are not as flexible as normal red blood cells, and have a shorter lifespan than healthy cells. Glucose 6-phosphate dehydrogenase deficiency occurs when the red blood cells are missing an important enzyme called G6PD. The lack of enzyme causes the red blood cells to rupture and die when they contact certain substances in the bloodstream. For the patients with G6PD deficit, severe stress, infections, certain drugs or foods can cause the destruction of red blood cells. Certain examples of such triggers include aspirin, anti-malaria drugs, sulfur drugs, non-steroidal anti-inflammatory drugs, naphthalene or fava beans. Pyruvate kinase deficiency is caused when the body is missing an enzyme called pyruvate kinase. And with this condition, the red blood cells tend to break down quickly. Acquired hemolytic anemias occur when the hemolytic anemia is acquired. In this condition, although the red blood cells may be normal, certain disease or other factors will cause the body to destroy the red blood cells in the spleen or bloodstream. With immune hemolytic anemia, the immune system destroys healthy red blood cells. The three main classifications of immune hemolytic anemia are autoimmune hemolytic anemia, which is the most common hemolytic anemia condition. For some unknown reason, this disease causes the body's own immune system to produce antibodies that start attacking our own healthy red blood cells. This disease may become severe and grow very aggressively. Alloimmune hemolytic anemia occurs when the immune system attacks transplanted tissues, a blood transfusion, or the fetus in some pregnant women. This disease can occur if the transfused blood is a different blood type than our own blood, and it can also occur during pregnancy when a woman has rhesus negative blood and her fetus has rhesus positive blood. Drug-induced hemolytic anemia occurs when a medicine triggers the immune system to attack its own red blood cells. In such case, one may be drug-induced hemolytic anemia. Chemicals in medicine, such as penicillin, can attach to the red blood cell surfaces and cause the development of antibodies. Mechanical hemolytic anemias cause physical damage to red blood cell membranes, which can cause destruction at a faster rate than normal. The damage may be caused by changes in the small blood vessels or due to the certain medical devices, high blood pressure during pregnancy called preeclampsia, or a condition that causes seizures in pregnant women called eclampsia. Malignant hypertension or a rare blood disorder such as thrombotic thrombocytopenic purpura that causes blood clots to form in small blood vessels throughout the body. Moreover, participating in strenuous activities can also result in blood cell damage in the limbs at times. With paroxysmal nocturnal hemoglobinuria, the body will destroy abnormal red blood cells caused by a lack of certain proteins more rapidly than normal. Individuals with this disease are at increased risk for blood clots in the veins and low levels of white blood cells and platelets. Certain infections, substances, and chemicals can also damage red blood cells, resulting in hemolytic anemia. For instance, toxic chemicals, malaria, tick-borne diseases, or snake venom.
This is the end of Part C. You now have 2 minutes to check your answers.